That's perfect.
Great. All right. So yeah, thanks very much for this opportunity. I want to talk today about, well, it's actually GroundsWell and another research consortium that we've got called Healthy Urban Places that I've added as well. But largely on GroundsWell today, really. It's a partnership run through 3 universities, Belfast, Edinburgh and Liverpool. And I'm one of the 3 co-directors. And I'm also an investigator in this Healthy Urban Places consortia. They both focus on healthy placemaking with HUP, as we like to call it, having a broader focus than GroundsWell. And GroundsWell is really about those urban green and blue spaces. So in GroundsWell, our vision is to reduce non-communicable diseases, particularly those who are less well off, and so reduce health inequalities. There's a large system transformation focus. So essentially, we're using green and blue spaces as our exemplar to understand how whole systems transformation is needed so we can delve deeply into this green and blue space system to transfer methods to other systems to make healthy places too. And to do this, we're working in partnership across different disciplines and with many different organisations such as yourselves, and I think that's really crucial. And so GroundsWell started way back in 2020, 2021. And I think at that time, I was talking to a local director of public health who said the provision of gym equipments in parks is important. And I thought, well, I don't disagree that those can be useful for some people, maybe like most of us here. But we found that something important from our new project that I've got up on the screen. So this was targeted towards priority groups, and after they participated in some community-led interventions, their well-being really improved. It went from low to medium well-being, signifying that the community-led nature-based interventions are important for these groups who would otherwise have no interaction with other people and would be quite isolated and lonely. And really the narratives along with the surveys that they filled in really let us understand that many people didn't know that their local park was actually for them to access, which was really profound, I thought. So the benefits are multiple for these groups. Some of them were refugee groups, some of them were ethnic minorities. They selected them based on deprivation and health burden as well. And yeah, the benefits not only improve their well-being and connection to nature, but also to each other. And I think that's how we can really begin to reduce inequity. And that's an important message that needs to go to all of our policymakers nationwide, I think, to support spending to be more equitable, because basically, if you build it, they won't necessarily come, and it won't be those who can benefit the most who do come, not without that extra bit of encouragement. So returning to think about our GroundsWell partners now, we signed up many partners at the application stage, and some of them applied for the relatively small pots, £15,000 up to, of GroundsWell funding that we named innovation funding. And the funding was fairly unique in that we had 1% of our total funding, about 80,000 in each city, reserved for this specifically. So we became the funder, which was an interesting change. And we're in the process of evaluating the sort of follow-on ripple effects of these projects. But we could already see that this funding was a sort of a catalyst to achieve the long wished for community-based projects of our partners who were closely linked to their communities. And then each project had the help of an embedded GroundsWell researcher to help them evaluate. And that funding in itself really was kind of a change to the system that overcame some long-standing challenges for participants who were really encouraged to use existing green and blue spaces. And here are some of the partners and their Innovation Fund projects. We've got the topic that we asked them to apply for was very loose, really. It was called Growing Together, and we asked them to complete a short application. And then write a little report at the end. And we gave them the template, and we asked to have, we offered the help of a GroundsWell researcher on that. There was a hand up, I think, if you want to jump in and ask a question. I think Charlotte. I can't hear you.
Apologies. I just caught it by accident. Sorry.
No, that's all right. No problem. If anyone does want to ask, then give me a shout out in case I don't see you. So we've got some videos as well on the website. I put the link for the website down the bottom here. And those Safe Regeneration website, the video is quite neat. It's all about the partially sighted community and how they improve their confidence by getting out on the water. And when we designed GroundsWell, the Mersey Forest actually is another one of our partners, told us that there's often no cash for things like a trained horticulturalist to help engage people in growing food, for example. And so, yeah, you could argue that our innovation funding sort of artificially changed the system, but we'd really advise, more funding pots like this to help with this healthy placemaking for all. And one of our aims in GroundsWell is to transform the data system. So thinking about these big bits of data like the GP records and the hospital admissions linked to environmental data. And I think there's real silos that we're trying to break down by, transforming the system. So there's silos in organizations. And I think sharing data across these silos really is a test. It's a challenging test to work out whether we can actually do it. So we want to link the organisations who hold the exposure data, the details of what's actually changed in our environment. That could be the local authorities and the NHS who hold the health data outcome. And so we're bringing all of these together to help us generate evidence on what works and for who. As I say to our NHS partners, it's no good looking at just the health service data when the root causes of ill health are determined by so many factors in the wider environment. And the data systems in Wales are more advanced, and I think some of you've been using some of our results from this older project that was published a few years ago now. And we had the joined up environmental data for 1 million homes linked to each person's health data for the time that they lived in that home. And we know green spaces are important because we evaluated 2.3 million adults in Wales. And our results show that there were fewer people reporting anxiety and depression to their GP if they lived in like the top third greenest area. And that was measured by satellite imagery, first of all. And we saw that being able to view green space close to home was associated with that fifth reduction of lower odds of developing that common mental health diagnosis, or CMD we've put for short. And I think the most convincing result to me is like number 3 here, and that was when we found the echogenic benefit. So thinking about those health inequalities again, and the benefit to mental health from living in a place that has more potential access to more green and blue spaces. And there was a larger protective effect for those in the most disadvantaged areas. So for people who had generally had fewer resources overall, they, higher unemployment, lower incomes, there was more benefit from their available parks, lakes, and outdoor nature trails. And I think that's really important because after talking to Dave and Penny and hearing about their proposals, we're trying to adapt our work now to include how to use these Welsh data so we can actually showcase what cost savings this could have on adult mental health from those, reduced GP visits for those in the most deprived areas. So if we made greener street investments, for example, and we brought those other areas up to their potential, we might be able to showcase the future costs saved to the NHS to offset that investment, which I think is quite exciting. So we'll keep you updated on that. We've got several similar analyses planned for Cheshire and Merseyside as well, because we've now managed to get, with great effort over the last 3 or 4, 5 years, some environmental measures into the health data linked at the household level, just like we did in Wales. And so we've got the 330-300 measure, which is 3 visible trees, and then I forget the rest, but I'll share a link of the data at the end in the chat. And we're sort of asking for this tree measure to be linked to the resident health records. and that's work we're doing with the Mersey Forest and with Wirral Council. And we've begun preparing to extract and analyse the mental health data and respiratory health conditions from the routine health data. And I think having these data linked at the household level is cause for celebration, because we really need that household level resolution to understand what's going on with our residents. Ideally, we'd have the temporal addresses too. So anything you can do to help us advocate to the NHS for using and getting those temporal address data would be brilliant, because I think having those data organised in time is more robust and allows us to have methods that ensure the health outcome came after being exposed to the more or less greenery, and not the other way around. And getting towards that sort of causality is very important. So now I'm going to move to talk about our partnership with Wirral Council, and specifically a proposed park in Birkenhead. It's a deprived area over the River Mersey from Liverpool, and this has now been earmarked for some Pride in Place funding. And I'm pleased to say that we're partnering with Wirral Council to develop and deliver some systems training with practical tools to help them structure themselves really to be most effective in the PIP endeavour, because as the local authority, they're accountable, but the delivery must be at community level. So I think that's causing a bit of uncertainty and a bit of uncomfortableness between the council. And so we've began working with Wirral about 5 years ago with the development of this Dock Branch Park evaluation. And at the time it was labelled as a catalyst project for green space regeneration. And so we're pleased now that they feel comfortable enough to be working with us to help we're going to help them with this complex systems training and help them structure themselves as best they can be to help them work with their community organisations. And so we offered to help Wirral Council evaluate the effects of this new park, the Dock Branch Park, with stakeholders from the community and council. And we held a series of workshops with these folks. And the first evaluability assessment identified key areas. Does Dock Branch Park benefit those who need it the most? What's the wider impact? And what is the extent of community engagement in this programme? And the second workshop was about methods, and we settled the sort of geographic area, the primary data collection methods and timelines, and the extent to which of community engagement and who should be included. And we found that stakeholders wanted to evaluate if this greening regeneration would impact the health and well-being of the people living and working in the neighbourhood, which is good because that's what we were interested in as part of GroundsWell, the non-communicable diseases. And we were also interested in understanding the role of the community panel. That's a public and patient group established fairly early on in the process. And the role of the wider community was also important to look at in terms of the stewardship of the park and the potential for the meanwhile use, some sort of smaller projects on adjacent green spaces, while the bigger project of the park design and the build were underway. And so we have an overview report on our website about recommendations for the evaluation, and we shared this as well with our stakeholders. And we understood that there were no pre-existing survey or interview data, meaning we'd have to collect lots of data through new primary data collections, or also extracting data from routinely collected data like the GP records. So we presented 3 options to our stakeholders, each one sort of more comprehensive and building on the last. And they went for the most comprehensive option, of course, to address all of the agreed evaluation outcomes, both intermediate and longer term outcomes. And so these are them here. And fortunately, there were some uncertainties. Perhaps with hindsight, these are more obvious and potentially could have been predicted using some systems thinking approaches. But these risks, especially the crumbly bridges and the liability of the bridges, meant that Wirral Council didn't apply to the most relevant active travel funding from the Liverpool Combined Authority. So I think, as well as the crumbly bridges and the liability risk, the second element really was the real push to build more homes. So just to the south of our main site, where all of our community engagement work was done, there's another site called the Hines Street site, which is on an old gasworks, and that was earmarked to have several hundred homes built on it. So I think that was part of the old Dot Branch railway site too, and that was pushed forward sooner for funding applications because of that real drive to build the homes. And from the university side, I think, yeah, I had to make the difficult decision not to do the baseline survey because it would really be too long until the original northern site was greened, and in the south there were really no people who were living on the old gasworks to be able to answer a baseline household survey. But we have continued with the routine data and the qualitative data. So we didn't do the household survey. But we've sort of invested in the routine and qualitative data to a greater extent instead. And so this work was led by my colleague Rebecca Crook, who's now on maternity leave. She explored the community engagement and involvement and did this collaboratively with the council public health team. And she found that the main challenges was leadership turnover, and there was a real loss of momentum when very enthusiastic people who were originally driving the project then left. The bridges, as mentioned, crumbly bridges were not good for the project. There was a community scepticism from seeing other projects undelivered, and the challenges of academic and evaluation funding not being written into these large programmes from the outset really removed some evaluation opportunities to generate some really good evidence for the next projects. Successes. So these include good working between the council and the university. Includes learnings on how to go about regeneration programs and evaluate them at the same time. And then we've built up a community group so they can actually accept monies now, potentially related to Pride in Place. And Wirral have really listened to the community and our team to help bring the views into the designs. So a few next steps, more capacity building, I think, is going to happen. We've got lots of work to do with the quantitative data, trying to make it as useful as possible for partners such as Natural England. And I know I'm over time, so I'll just say we've got some loads of different creative and community-facing outputs on our website. If all of this is really quick, then I did deliver an inaugural lecture last year on topics. So I think there's some really interesting bits more in depth about 30 minutes in. And we'd like to invite you to our National Summit on Healthy Futures on the 16th of June in Liverpool. And we'd love for you to come and join us. And your insights and experience will bring like a really important perspective to the conversation and help unpack the complexities of creating healthier cities in practice. So all we ask is that you let myself or Ellie know so we can order the right amount of food and drinks on the day. So you'd be very welcome to come join us. And I think that's my last slide. Oh yeah, last slide. That was just a element of trying to bring some green in that I noticed when I visited a city in France that is potentially useful when there's really no other opportunity. So it can be done. And that's it from me. Thank you.
Sarah, that was absolutely